The Affordable Care Act was passed in March of 2010, but still over 2 years later, the public remains deeply divided on the issue. In a recent Kaiser Family Foundation poll, 43% responded unfavorably to the reform law, while 38% responded favorably and 19% refused to respond or said they were unsure. A little uncertainty is to be expected. The Affordable Care Act is big. Thomas Wright, the executive director of the PinnacleHealth Medical Group, has become very familiar with it.
The healthcare reform law itself is a very, very large piece of legislation.
The law itself is over 2,500 pages in length. It would be ambitious to think you could sit down and breeze through it, maybe even more ambitious to think you would come away with a complete understanding of how the law would affect you on a personal level.
I think the first thing they have in their mind is, what difference does it make to me? And that is really unclear to many people.
In fact, another poll done by the Kaiser Family Foundation showed 41% of Americans said they were confused by the law. In order to gauge Americans' understanding of the Affordable Care Act, the Kaiser Family Foundation conducted a 10-question quiz. The quiz asked Americans whether they thought a series of provisions were included in the law. 5 of the provisions are actually included in the law. They are: the law provides subsidies to low and moderate income Americans. It prohibits insurers from denying coverage because of health status. The law provides tax coverage to small business owners that provide coverage to their employees. It includes an individual mandate. And the law expands the existing Medicaid program to low-income, uninsured adults, regardless of whether they have children. The other 5 provisions included in the quiz are not part of the Affordable Care Act. They are: the law would not allow a government panel to make decisions about end-of-life care for people on Medicaid. It would not allow undocumented immigrants to receive financial help from the government to buy health insurance. The law would not cut benefits that were previously provided to all people on Medicare. It would not create a new government-run insurance plan to be offered with private plans. And the law would not require all businesses, even the smallest ones, to provide health insurance to their employees. Here's what the quiz showed. Less than 1% of Americans got all 10 questions correct. Instead, most respondents hovered around the middle, answering 4 to 6 questions correctly. Thomas Wright says one reason there's confusion surrounding the law is that much of it hasn't impacted anyone yet.
Although there's been a great deal of debate about it, very little of the law is in effect today. And so the pieces of the law that are in place today, the one that people know the most about is the fact that if you have children who were on your health insurance plan and they go away to college or they leave the house, if they're under the age of 26, under the law today, you can keep them on your insurance plan. Before the law, you could not. The really controversial parts of the law, the health insurance exchanges as an example, the mandated insurance benefit component, that's not effective until 2014.
Still, Wright says it's not too early to start getting to know the law and imagining what the future may hold.
Pennsylvania is one of those states that is gearing up for the health insurance exchange, which has to be in place in 2014. We have less than 14 months before that has to be available to the public, so no, it's not too early to be asking these questions.